and welcome to the NVS podcast. I'm Fiona Farmer and I'm going to be your host for today. I'm a vet and there is nothing that I love more than talking to other colleagues exploring the latest thinking and techniques in veterinary medicine. Today I'm joined by Cunha and Ali McGrath, and we're going to talk about all things digestive health. Carolina is a vet with over 8 years of experience as a companion and large animal practitioner. She ran her own clinic for over 6 years in Portugal, and she now currently works as a product and account executive of CF Farmer. Ali is a product development manager at CF Farmer, where she's been at her role for over 2 years. She has a background in biology and chemistry and has lots of experience in developing products, including feed which targets digestive health in companion animals. So they are both perfectly suited to talk to us today. So hello to you both.
Hi Fiona, how are you?
Hello, how are you?
I'm good. I'm glad to have you both here. So, digestive health in companion animals is such a huge topic, and it is getting more and more interesting the more we're learning about the gut microbiome. But for today, let's keep things really practical. We're about to head into danger season. We've just had fireworks night, and around the corner we're straight into Christmas, and with that comes travel, change of routine, there's lots of visitors in the house, and of course there is the increased risk of our animals ingesting things that they really shouldn't be. Carolina, can you provide some practical advice for us on how our vets can be supporting their pet owners during this time?
Hi. First of all, I would like to thank you for being here. And of course I can. I think one of the most important tips that we can give to owners is to teach them to ask their guests not to give treats to their pets. I think this is like one of the most important things, because people do connect like giving treats to affection. So they are actually being really well intentioned, but they can be really causing a lot of damage. And we know that dietary indiscretion is one of the most common causes of non-protein loss enteropathy by malabsorption. And we do know that these kinds of unwanted treats can cause a lot of disruption into dogs and cats' microbiome. It can be caused through physical irritation. Like, let's think about bones. Do we often give bones, or we often hear of bone giving to pets? We do. So the thing is, dietary indiscretion can lead to ingestion of toxins. Let's think about chocolate, for example, excessive fat. Let's think about everything that we eat during the holiday season. That can increase of compound that cause gastric fermentation, and this gastric fermentation will imply with the gastrointestinal microbiota. And we do know that the microbiota is really important for the good function of the gastric health system. But there are still a lot of things that we don't know about it. We do know, for example, that there is a lot of misuse of antibiotics, and this acute diarrhea is caused by dietary indiscretion. The gastrointestinal microbiota is essential for gut health and for the immune regulation. But this deep connection between diet and microbiota is not yet fully understood. We do have a lot of theories about how this works. And we do know by clinical results that providing pre and probiotics do have really good clinical results. And we do also know that there is a lot of misuse of antibiotics in this acute diarrhea by food indiscretion. And I think for vets just to be aware of it, like don't go all in on the antibiotics as soon as you find acute diarrhea by food indiscretion. What the gut needs is rest. And when I say rest, I'm not talking about fasting. So I'm saying about providing diets that are really easily digested and support at a microbiota level. So if you'd give like probiotics, prebiotics, if you would give binders to help the fecal content to get more consistency, if you would provide electrolytes, if you would provide like nutritional ingredients that would help the gut to heal easily and faster. Because we do know that a lot of this acute diarrheas would go and be fine in a few days. The thing is, we want to make this recovery period shorter for our animals' welfare and for ours. It's not easy to deal with our pet having diarrhea. So.
Absolutely. And it makes sense, doesn't it, that you want to support the gut where it's struggling. So that makes absolute sense what you're saying there. And I really like what you said about setting those boundaries before people come into your home. Because as vets, we all know how difficult it is just with owners not giving their animals things they shouldn't be having. You know, when they're looking up at you, those puppy dog eyes, and it can be hard not to just give in and keep feeding them things that might not be good for them. So I think that it's vitally important for people that might not have pets of their own to know that actually, although their intentions may be good, it's not actually the best thing to be feeding pets these things.
And teach them about toxic foods like raisins, onions, chocolate, because a lot of owners don't know that. I think that kind of information is very valuable for owners, and a lot of them just don't know, and they are not intending to do harm, but they are.
Yeah, and if no one's ever told them, then how are they supposed to know? Ali, now that we know a little bit about what's actually happening to our dogs and cats during these times of gastrointestinal upset, you've got a lot of experience with different types of products that can help vets overcome this. What would you advise our listeners to be offering in this instance?
Yeah, so like what Carolina said, we would advise vets to offer a product that contains a probiotic, a prebiotic, a binder, especially in cases of dehydration. So you want a product that contains a high level of electrolyte, a highly digestible carb, so stuff like this. So ingredients like this really help. So when we worked on a product to aid in the recovery from acute diarrhea, we made sure to include ingredients like this. We want to get the smart way to aid the recovery of acute diarrhea. So the smart way kind of stands for stabilizing the gut. So Carolina mentioned about the gut health, make sure the microbiome is healthy. So the smart way would be to support the gut. So the microbiome is going to be supported with prebiotics and probiotics. Absorption will be a major factor in the recovery of acute diarrhea. So that will be where a binder will come in, and that will help then, and the absorption of water as well. Reduce, so R stands for reduce, so reduce fat content. So a product we worked on will have a low fat content, and that will aid in a quicker recovery for acute diarrhea. And then T will stand for a top of electrolytes and energy. So another key ingredient would be an energy source. So the likes of L-glutamine, that would help aid the recovery in diarrhea. So again, we mentioned we want to help the animal recover from diarrhea as quickly and as helpful as possible, that they're back to themselves, because it is hard to know or hard to see your pet when they're in discomfort.
Think smart. So let's just remind ourselves, S is for stabilize, M is for microbiome.
Yeah, so then A is for absorb. So that'll be the absorption of water, and then the binder will be absorbing or binding that anything that is not wanted, basically, that's upsetting the microbiome. R then is for reduced, and then T is for top up. So top of electrolytes and an energy source.
Think diarrhea, think smart. Wonderful. Carolina, owners are often asking what to feed their pet when they're going through a digestive upset episode, and I think that there's quite a lot of confusion over what the best approach is amongst not only vets but pet owners as well. So based on what Ali has just explained, it really does make quite a lot of sense to add in a pre and a probiotic. But what about the actual food itself? What should we be feeding our pets when they're going through GI upset?
That's a really interesting question, because there is a lot of talk and conversation about what should we give our pets when they're going through a phase like this. So as I mentioned, the thing that we are aiming here is to give the intestine a bit of a rest, and to give all the gut a bit of a rest. So although like the chicken and rice is like the classical approach, and I'm not completely against it, because if you think chicken is a low-fat, high-protein food, and rice is kind of a good source of starch for a pet, it just needs to be really, really, really well cooked, like a mush, because often it happens that owners don't cook the rice properly, and then they are causing more harm than good. Other things that you can give would be, and we are talking about now homemade meals. And I'm providing tips for homemade meals because a lot of owners do feel that cooking for their pet when they're ill is like a way of showing affection. I do think that commercial diets to this stage, it's less likely for you to go wrong with commercial diets. However, we should teach or we should read the owner that we have in front of us, and to see if he will want to cook a meal and provide affection in that way, or he will just be prone to buy a commercial diet. And if he really is keen on cooking for his or her pet. So options would be like boiled turkey and potato, or lamb. Just remove the fats. Like low fat content is really, really important. And that's how Ali was saying, like not providing any kind of fat at this point is really, really important. Low fiber is really important too. But the main thing is to teach the owner that this has to be like 2-3 days tops. If the diarrhea persists, we will need to investigate a bit more, because chicken and rice and potatoes and turkey are not well-balanced diets whatsoever for pets overall. I do think there is still the myth of fasting. We now know, supported by a lot of scientific papers, that we should provide food while the diarrhea persists. Of course, if the dog or cat is vomiting, we will have to control that first. But please don't fast your pets. And to just provide, for example, when we have a puppy and the puppy is on training, there is a misconception that we stop giving treats to that puppy. And sometimes you will miss key days on that puppy training. So you can provide bits of boiled chicken just to keep the training, just for 2-3 days tops. Then you will need to go back to a well-balanced diet.
Yeah, that's right, isn't it? I think home cooking, as you say, is coming back to what we spoke about at the beginning, about wanting to give pets treats out of love. But what I'm hearing from you is that actually these commercial diets are very well balanced and very well suited and tolerated by dogs. And actually, if they're already on those, then perhaps staying on these is actually the best thing to do.
And I totally agree with you, but we have to understand that some owners do resist give commercial diets. And if they do resist giving that, we must teach them how to give the proper dietary care through this stage.
You touched on there about feeding in this manner only for a couple of days, and then we go from acute to chronic. And I just wanted to explore that a little bit about our approaches to chronic versus acute cases when it comes to digestive upset. So to get a line in the sand, at what point does it become chronic? And would you say that most acute GI upsets are because of dietary indiscretion? And how would you suggest that we go about discovering whether this is the root cause or not? And if it is the root cause, which I think for a lot of our cases that we see it is, which approaches can we apply to these patients who are repeat offenders when it comes to scavenging?
So we do differentiate between acute and diarrhea, and it's just a time scale thing. So there are some authors that refer 2 week, others 3 week. In my daily practice, I would use the 3 week approach. And if the dietary indiscretion is the most common cause of acute diarrhea, in my practice, or what I've seen, it is, but you have to see what kind of patient that you have in front of you. So, and what kind of diarrhea that you have in front of you, because there are kind of diarrheas that are more connected to small intestine other than large intestine. So you kind of have to have a clinical eye on it. And when you talk about chronic diarrhea, that's a whole different conversation. Of course, when you talk about acute diarrhea, you do have to consider parasites and infections. Are you seeing a puppy that is not fully vaccinated yet? Or are you seeing a dog that is really, really ill with high fever and pale mucosa and overall signs of systemic illness? I had a teacher back in college that used to say that we make more mistakes by not doing a proper clinical exam than by not knowing. So just this topic could go and last for a book.
There's so much to talk about, isn't there? So if we're thinking about these scavengers, that's one of the reasons that we see acute GI upset. Ali, do you think there's any useful tips that we could give our vets to tell their pet owners what they can do to try and reduce this from actually happening in the first instance?
Yeah, so we've touched on it a few times in this conversation. So the most important thing is to train your animal to stop and to listen. So if they're trained not to eat the same food or to be begging at a table, and guests need to be aware of the dogs and if they're allowed to have treats, what certain types of treats and their dietary requirements. So if they don't need it and they shouldn't have it. And again, we spoke about this before. They have to be aware, owners have to be aware of what dogs and cats and animals can and can't have. So there's a lot of food that we'll be able to have that is very, very dangerous to animals. So they have to be aware, they have to do their research and just ensure that what they're sharing with their dog or the treats that they're giving to their dog or their cat is safe for them. There's also a practical tip that pet owners can do. So have a pet friendly bin. So it's not easy accessible bin or the rubbish, that it's always closed off, that it's gated, that it's not accessible by the dog or the cat. And then just the word stop, it has to have an impact to the animal. So if they're told to stop or if they're scavenging somewhere, it has to be that the training is there that they need to stop, because at the end of the day, we just want to keep our pets safe, and that would be the best thing to do. Is just training is the best thing, most practical way.
I do agree with you, and I'm not a behaviorist. But there is one tip that I do find very effective. It's like, teach your dog to eat on command. When you're giving your dog his meal, just teach him to eat on command. Teach him to wait. This kind of control would really prevent situations like the ones that we are describing.
Mm-hmm.
So pets eating what they shouldn't be eating is a universal problem, and we do see it regularly, and we particularly see it more regularly over the holiday season. Now, Ali, I know that you've been working on a unique new product to support vets with this. Would you like to explain why you've done that and what the product is?
Yeah, so we worked on a product that basically is to give pet owners a peace of mind when you know your dog or cat or animal is after eating something, and it's something that they shouldn't have eaten, but how do we treat it? Because the first question that a vet will ask is, what have they eaten, or do you know what has caused the upset? So currently on the market, we have the main binder for treatment is activated charcoal, but it doesn't cover a huge range of absorption. So we worked on a product that contains activated charcoal and bentonite. So now you have two binders that give you a broad range spectrum basically for absorption. So also in this product then we have additional ingredients. So we have sorbitol and glycerine. So now you have your two binders and you have these ingredients that will reduce the gut transit time. So it will make sure that whatever has been ingested moves out and passes through the animal as quickly as possible. And then there's another two ingredients, curcumin and pepperin, and they're there just to aid in the recovery for the normal function, not even the recovery, but the normal function of a liver and a kidney. So there's 6 major active ingredients there that will differ from what's currently on the market, but will offer a broad, wide range spectrum for absorption. And just for pet owners that don't know what their animal have eaten and they want to get it passed as soon as possible.
That sounds really useful, and not only for the pet owner to not have to be worrying about that, because often they don't really know what it is that their pet has eaten, but also from the point of view from the vets. Like you mentioned, there's 2 different binders and they bind different things. Vets working in practice, we don't always know at the top of our mind in that situation which brand we need to use for whichever unknown thing that the animal might have ingested.
We actually don't.
So having them both together in one product means that we can safely give that, and we know it's going to do the job, and we know that we don't need to know exactly what the dog has eaten or when it's had it. Carolina, what are we actually trying to achieve when we use these oral products? When we've got a pet that's eaten something they shouldn't have done or they've scavenged, what do these oral products actually do and how do they work?
Well, the main thing that we try to do when we suspect of toxin being involved is to get rid of the toxin as fast as we can. And we do that by classical thing that we do first is induce emesis. And we do that with different things. We know that in cats, alpha-2 agonists are more effective, and in dogs, apomorphine, it's more effective. Gastric lavages are very effective at this point. And then to use like effective binders, because if we don't know what's happening, to just have the peace of mind. For example, we do know that activated charcoal is not effective on every kind of toxins or toxic or potential toxic substance that we do find in our household. For example, xylitol, the sweetener that we do use a lot during the holiday season. Diosmectite would be more effective on a substance like that. And we do use in a clinical basis, we do go often for the high intensive fluidotherapy, and we do go for liver protection substances.
Ali, what are the most commonly ingested toxins that we see in our pets?
Yeah, so a questionnaire lately was carried out, and vets were asked when pet owners come in, what will be the most common toxins? And we're probably not surprised. We have mentioned it before and in this conversation. Chocolate, food, that's the number one common toxins for animals coming into veterinary clinics. And followed by this is the likes of plants. So even though we love seeing them in our house and they get a lovely smell, they can be toxic towards animals. So the type plants like lilies. So that'd be the second common toxin that comes into veterinary clinics. And then this is followed by human medicine. So again, I think it links back to the practical tips that we mentioned before. Owners need to be aware of where their dogs are scavenging or where they're looking, but they need to be trained of the food that's toxic towards animals that has a different effect to animals that would have for humans, and just to be aware and protect the animals. So keep your medicine, and a lot of medicine will state on their label, keep out of sight of animals and kids, and this is for that exact reason. It's toxic towards animals.
And I guess it's worth reminding our listeners that there's always the veterinary poisoners hotline to call if they need to speak to someone for more guidance. Now, we often think about dogs when it comes to GI upset because, dogs are scavengers and they eat things that they shouldn't do. But we shouldn't forget about our cats. Where do cats fit into this, and how often do we see a cat with GI upset?
That's a very interesting question, because it's true that cats are not such a big scavengers that as dogs. Cats are picky eaters, and that in kind of a way protects them for all of these kinds of things. But they are also more prone to GI problems due to a toxin ingestion, like the plants, the lily. Mm-hmm. The lily is very common in cats, actually, or like medications such as paracetamol, ibuprofen, and the problem with that is owners take longer to notice the GI upset than they do in dogs. Just because of cat behavior, they do tend to hide more, especially when they're sick. And we do also have to consider that owners are less prone to bring cats to our practices, and cat owners are more sensitive to stress, cat causing stress,
And it's worth noting that lots of clinics are now promoting cat-friendly practices.
They are, and they should. It's really good. It's a really good practice, because that provides confidence for the owner, for the cat owner, to bring their cat not only more often, but more quicker when something happens.
And Ali, these products that we've been talking about, are they designed to be user-friendly for cats as well as dogs?
Yes, absolutely. So like we are saying, cats can be a lot pickier than dogs. So we try to make it as comfortable for cats and dogs. So when we're in development stages of products, we make sure to take this into consideration. So for the difference between a paste and a liquid product, so we ensure that our paste presentation comes with a wide nozzle. So this allows for an easy administration and quicker. So we're not upsetting the cat. So when they're upset anyway, we don't want to further upset them. So nice and quick administration with a syringe. It can be done one-handed. But if that's too much for your animal, then a lot of our products will come in a liquid presentation also. And especially with the binder products, our nozzle will be flexible and it'll be long. So it'll be a long, flexible nozzle on the top of an easy to squeeze bottle. And then that'll ease administration for cats as well.
Thank you both so much. It's been a really interesting conversation about an overview of acute GI upset, what happens when our pets go and eat things they shouldn't do, or just have an acute episode of diarrhea. And it's been really interesting to learn about these two products we've spoken about, the digestive paste and the Duotox. I would urge any of our listeners, if they have any more questions or if they want to find out about any more of these products, then head on over to the MVS website or the CF Farmer website, where you can find information and resources about both of the products. So I just want to say a big thank you to both of you for your time today. It's been absolutely brilliant to talk to you and listen to you and learn from you. So thank you ever so much.
Thank you so much for having us. Thank you.